All right, so it looks like participant numbers have started to stabilize, so we'll get started. So good afternoon, and thanks everyone for joining us at the Kirby Institute's seminar series for today. I think most of you will know me. My name is Ben Bavington from the HIV Epidemiology and Prevention Program here at the Kirby Institute, and I'm also the chair of the Kirby Institute's seminar series. So I'd like to, of course, begin by acknowledging the traditional custodians of the lands on which we all gather here today and pay my respects to their elders past and present. So in my case, those are the Bidjigal people of the Eora Nation, and I extend that respect to Aboriginal and Torres Strait Islander peoples joining us today. So just some housekeeping to start off with. The format of this seminar will start off with a presentation, then there'll be a brief discussion between two of our guests today, followed by audience questions as usual at the end. So you can ask your questions throughout the entire session by clicking on the Q&A icon at the bottom of the screen and just type it in. So you don't have to wait till the end of the session. Please ask your questions throughout because it means we can get the discussion going as soon as the speakers end. So apologies for the state of my voice. I'm hoping that's going to last the hour. And if it doesn't, then our speakers are just going to have to handle the questions at the end by themselves. So first, I'd like to introduce our first speaker, well, both speakers actually. So Dr Horas Wong will be our main speaker today and is a lecturer at the Sydney Nursing School at the University of Sydney. Horas led the project coordination of the Gay Asian Men's Survey in 2021. He's an affiliate researcher at the Centre for Social Research in Health and at the Kirby Institute with us here at UNSW. Horas has a transdisciplinary background in nursing, public health, anthropology, and health social sciences. And his research interest is gender and sexuality, migration, and qualitative research. So welcome, Horas. Horas will be joined today in discussion by Associate Professor Limin Mao from the Centre for Social Research in Health in the Faculty of Arts, Design and Architecture here at UNSW. So Limin's social and behavioural research focuses on working with priority populations to prevent and manage HIV and other STIs in Australia. And her passion is to empower people with diverse gender and sexual, cultural, and linguistic backgrounds to improve their health and social well-being. And Limin was one of the original founders of the Gay Asian Men's Survey. So I'll now pass over to Horas, and then Limin will come in later for the discussion.
Sure. Thanks, Ben. Let me share my screen. Okay. All good? Okay. Thank you very much, Ben, for the kind introduction. I would like to also first acknowledge that I'm joining this webinar from the lands of the Gadigal people of the Eora Nation. I also acknowledge the traditional custodians of the various lands from which you joined today and the Aboriginal and Torres Strait Islander people participating in this webinar. My name is Horas. As Ben said, I was the lead project coordinator of the Gay Asian Men's Survey 2021, and I am now appointed as a lecturer at the University of Sydney. And before moving to UC, I had also worked at the Kirby as a research associate and also as a registered nurse at the LBN Centre, providing frontline HIV and sexual health care to community members. So today, sections, there will be two different parts. In the first about 30 minutes, I will present the backgrounds and the major findings from the Gay Asian Men's Survey 2021. And then Limin will join me to discuss some lessons learned from our experience in doing research with Asian, gay, and other men who have sex with men in Australia. And we hope to have some discussion with the audience as well and answer your questions. Just some research background of the survey. I believe the audience would today would be aware that while the number of HIV notification among Australian-born gay and bisexual men have decreased significantly over the years, especially after PrEP has been made widely accessible, HIV notification among overseas-born men have stayed fairly consistent over the years, which led to a situation that a significant proportion of HIV notification nowadays contributed by overseas-born men. At the same time, among overseas-born people, most were born in an Asian country. And the number of Asian-born migrants and immigrants have increased significantly over the past 10 years. Before COVID, a lot of Asian immigrants, including myself, came to Australia, started as an international student or temporary visa holders, and then decided to stay. So this could probably explain the significant drop of Asian migrants when the Australian borders closed due to COVID in 2020. but it is also expected that the number will resume gradually back to pre-COVID levels in the coming few years. And I believe that you already know that it's important to recognize the social determinant of HIV risks on top of individual factors, such as like the effect of employment, stigma, how they affecting HIV risks. And in order to have a better understanding of the factors contributing to the HIV situation among Asian, gay, and other men who have sex with men in Australia, it is important for us to examine the intersectional factors in relation to sexuality, in relation to culture and migration and other different factors, etc. Therefore, in 2015, the New South Wales Gay Men Action Groups, which is an initiative established between UNSW, ACON, and representatives from local LHDs and New South Wales Health, restarted and refined the Gay Asian Men Survey. I use the term restarted and revived because the survey was actually first introduced by Associate Professor Gary Christoph at the Kirby Institute and Paul Van Devon of the National Center in HIV Social Research back in the late 90s. And Limin led the survey 20 years ago in 2002. So Limin has been doing this survey for like 20 years. And the Gay Men Action Group restarted it in 2015 and then 2018 and then 2021. The survey is a cross-sectional study of HIV and sexual health related needs among gay and other men who have sex with men of Asian backgrounds living in Australia. The survey mainly focused on those who are living in New South Wales. We did extend to national recruitment in 2018 and 2021 as an additional arm of the study. But the target audience was mainly in New South Wales, partly because of funding limitations and also because that New South Wales, particularly in Sydney, is the most popular destination for Asian migrants in Australia. And we adopted a community-based participatory research approach in which we worked closely with the funder, which was the BRACE program, and community workers, community members, clinicians, and researchers through the Gay Asian Men Group, Gay Men Action Groups in every stage of the research. And each round of the survey evolved based on the lessons learned from previous rounds, and we refined the questions and recruitment strategies based on the feedbacks from community members. So in the latest round, in 2021, the inclusion criteria, including those who are at least 18 years old, who self-identify as a man or a transgender person, who self-identify as Asian or having an Asian heritage, and who has sex with another man in the past 5 years, and who are currently living in New South Wales. Due to COVID restrictions at that time, we only recruited people from online channels in this round, mainly Facebook advertisements and announcement in partner organizations through their email list or WeChat groups or websites. Some partner organizations, including ACON, Multicultural HIV Hepatitis Service, and ENTRA. ENTRA is a community organization, especially for Mandarin and Cantonese-speaking LGBTIQ people living in Australia. And previously, we also recruited people from Rare News and from sexual health clinics, but this round, it wasn't feasible for us to do so. And we developed a study webpage, and there was also a prize draw to win $100 visa vouchers after participations, and there were 10 winners. What you're looking at now on the study website, on the left-hand side, it was the study website in 2018. And on the right-hand side, it was the website in 2021. I want to show you this because back in 2018, we got some feedback from community members saying that the website, while it was very eye-catching and appealing, some community members found it quite embarrassing to log onto the website, especially for those who wasn't that out and for those who were living with their family members. And the website wasn't really very inclusive because they were full of images of the mainstream muscular body type. So we took that feedback and tuned down the design of the survey in this round and to make it look more professional and academic, and in order to make it more culturally appropriate and inclusive in our images. So this is one example of how we refine our study strategies and recruitment based on the lessons learned from previous rounds. Sorry for the busy slides. For the questionnaire in 2021, it covers a range of areas from demographics to gender and sexuality, relationship status, sexual practices, testing practice, biomedical prevention, substance use, culture and belonging, and mental health. We explore different areas that were not explored before, including some disability status, including religion, migration-related factors, and also serodiscordant interracial relationships and non-consensual sex, and also the first test in Australia, and all these different kind of topics that some of these topics were not explored in previous rounds. It took roughly 15 to 20 minutes to complete the survey, and the survey was translated into Chinese, simplified and traditional Chinese, and also in Thai language. The translation was checked by community members to make sure it was appropriate. And translation is actually something that Limin and I will want to talk a little bit further at the end of this presentation. Before I move on to talk about the results, I would like to draw your attention to the report of the study, which had already been uploaded to CSRH website. You can either scan this QR code to access to find the report, or just Google Asian Men Survey or go to CSRH, then you can find a report of the survey. We have also prepared some infographics with ACON that will be circulated to with the community. Probably you will see these images being circulated on social media very soon. Okay, I guess you must be curious about the results. So in the coming 10 to 15 minutes, I'm going to talk about the results of the survey, focusing on the participant characteristics, testing and treatment, condom and PrEP use, other sex-related practices, violence and non-consensual sex, and the mental health of participants. Between March to June 2021, we received 760 completed survey in the New South Wales arms of the survey. 73% were living in Greater Sydney region. Majority of them were cisgender men, as indicated by 97% were assigned male at birth and 94% identified themselves as a man. The median age was 30, the youngest one was 80, the oldest one was 65, and about 1/3 of the participants came to Australia within the past 5 years. And although most of them had attained university educations, around one in four participants actually earned less than $500 per week, $500 per week in the previous 6 months, which was actually below the poverty line of weekly income, according to Australian statistics. And 3% of our participants reported they were living with a disability, mostly mental health related, and half reported being religious or spiritual. The most reported religions were Christianity and Buddhism. Importantly, 82% of the participants reported that they had not participated in the Gay Community Periodic Survey 2021, which was conducted almost around the same time when this survey was conducted. This shows that we have actually recruited a different cohort compared with the Gay Periodic Survey. For the birthplace of participants, most of them were Australian born, followed by mainland China, Thailand, and Malaysia. This round, we recruited significantly fewer overseas-born participants, and more of our participants were permanent residents and citizens compared to the 2018 round. Obviously, because of the border restrictions and border closure during COVID, and a lot of temporary migrants might have left the country already. But still, nearly half of all participants said that they spoke a language other than English at home. And amongst the overseas-born participants, only around half of them reported they were fully confident in speaking English without preparation in advance. And for ethnicities, a third of the participants reported being ethnic Chinese, such as like Australian-born Chinese or Chinese, ethnic Chinese people from different countries, and then followed by Thai people, Filipino people, Indian people, and also multi-ethnic people. This graph shows the trends in HIV and STI testing and self-reported HIV positive status across the 3 rounds of the gay Asian men surveys. You can see there was a significant drop in HIV and STI testing in the latest round of the survey compared to the previous round, which we believe was due to the impact of COVID on sexual practices and also on the disruption of sexual health services. It is not shown in this graph, but nearly half of the sexually active participants in our report saying that they had fewer sex during the pandemic compared to before the pandemic. So possibly they didn't have a lot of sex, so they didn't think there was a need for them to have a test during the pandemic time. And overall, about 5% of participants reported they were living with HIV when completing this survey. So among the 36 participants who were living with HIV, the 5% participants living with HIV in this survey, nearly 90% reported that they were on ART, which was an increase from 79% in 2018. But please also be aware that, as I've said there, we have recruited more PR and citizens in this round compared to the previous round. And HIV treatment is still, until today, currently not accessible free of charge for people who are not eligible for Medicare. But this will be changed in 2 weeks. As from July, the 1st of July, individuals with HIV will be able to access their treatment by going to government-funded hospital pharmacies, regardless of their Medicare status, which is a welcome change. And 70% of the HIV positive participant in the survey reported that they had an undetectable viral load in their most recent viral load tests. And what's worth noting here is that about 14% of HIV positive participants, or about 1 in 7 HIV positive participants in the survey, said that they did not have a viral load test in the last 12 months, or they forgot, or they were not sure about the most recent viral load tests. So this poses questions about the regularity of HIV follow-ups among those people. Sexual health clinics and GP were the most reported venues for the Asian gay men survey participants to have their most recent HIV tests, which further supported our hypothesis about the decrease in HIV testing services during COVID, because a lot of sexual health clinics and a lot of GP have their service cut down during service, which may affect the overall testing rate that was reported in our survey. We also asked those who never had a test, why didn't you have a test? And many said that they didn't think they were at risk, or they were in a monogamous relationships. But what's worth noting here is that about half of the participants saying that having no symptoms was one of the reasons for them not having an HIV test, although we didn't ask them what kind of symptoms they were talking about. And there were around 10% of people who never have a test reported encounter structural barriers, such as not knowing where to get a test, or they might be concerned about confidentiality. This is something that we could work on. And we also explore the testing behaviors among the migrants who arrived within the past 5 years. So among the migrants arrived within the past 5 years in Australia, 75% have ever tested for HIV, and many of them actually have ever tested in Australia. And we further asked those who had ever tested in Australia to estimate when was their first HIV test in Australia. And among them, about 2/3 of them said that they had tested within the first 12 months arriving in Australia. So overall, just changing the denominator, we can see that about 14% of all recent migrants who came to Australia within the past 5 years had an HIV test in Australia within the first 12 months after their arrival. And this graph shows you the trends in condom use and PrEP use and PEP use across the 3 surveys. It was found that the PrEP use increased quite significantly over the years. And at the same time, fewer participants reported they use a condom consistently, that means using a condom every time with their casual partners across the years. And PEP use also decreased slightly over the years from 19% a few years ago. And then with this year, we only found 15% of participants, they said that they had used PEP in the past 6 months. Yes, that's increase of PrEP use and decrease of condom use. And regarding condom and PrEP use with different types of partners, not surprisingly, fewer participants said that they had used a condom with a romantic regular partner. A romantic regular partners means such as a boyfriend, a husband, or and compare with other types of partners. And non-romantic regular partners, we define it as like someone that they have sex regularly, but there is no romantic relationship between them, such as like a friend with benefits or someone that just they have sex regularly. And casual partners means completely strangers or casual hookups that probably they met online or at a sex on premises venue. And we can also see that there are quite a lot of people prefer to use PrEP either on daily or on demand, even if they were not using condoms consistently. We ran binary logistic regression to see who were less likely to use PrEP in the past 6 months, and find that participants who lacked confidence in speaking English, who were holding a bridging visa, and who reported earning a weekly income below $1,500 were significantly less likely to have used PrEP in the past 6 months after adjustment to age, number of sex partners, and location of residence, and also Medicare status. A bridging visa is a temporary visa that a person can stay in Australia lawfully, but their immigration status is more in limbo. And just to put the number into context, the median weekly income of all men in 2021 in New South Wales was $1,400. So people who earn a around the median income or below the median were less likely to use PrEP in this study. And you can see that these are actually all social determinant factors. And other interesting findings about PrEP was that sharing of PrEP. We found that in our study, 1 in 4 PrEP users in the Asian Women survey actually has shared their PrEP pills with someone without a valid PrEP script, or with someone that they were not sure that person have a script or not. We could not identify any published data on PrEP sharing in Australia, but there was a study in the US conducted, I think 1 or 2 years ago, reported that about 10% of their PrEP users had shared their medications. So it was quite surprising for us to find that like nearly 1/4 of our PrEP users in our study reported they had shared their pills with other people. So further research is needed to understand why people share their medication, Was that because of the cost, or was that because of accessibility of PrEP, and on what circumstances they share, and the possibility on the possible effects on drug compliance, etc. Some more information about sexual practices. In this study, we were also interested in sex happening outside Australia. And we asked them, when was the last time you had sex outside Australia? And we found that actually 70%, many of them had ever had sex overseas, and 41% of participants actually had sex overseas within the past 3 years. The top 3 destinations of people having sex overseas were Thailand, China, and North America. They may have had sex with someone they knew, or like a boyfriend, like a friend living overseas, or just with a casual male partners or hookups they met overseas. Importantly, among those who had had sex with the casual partners outside Australia, 14% indicated that they did not use a condom or PrEP with their most recent casual partners overseas. That also reminds us to think about the sexual linkage between Australia and other countries, how sexually transmitted infection or HIV may be transmitted through like this kind of casual hookup and sex happen overseas. We also explored intimate partner violence and non-consensual sex. And 12% participants, about 1 in 10, reported they had experienced physical, emotional, or financial abuse from their partners or ex-partner in the past 12 months. And less than 10% had a condom being removed secretly by a sex partner during sex. And about 6% reported they had had non-consensual sex or been raped in the past 12 months. Which these numbers seemed not quite high compared to some older study conducted like 15 years ago in Melbourne, that up to 40% of male identifying participants in this study had experienced physical violence with sex within a same-sex relationship. But violence and non-consensual sex is definitely an understudied area that worth further explorations in future studies regarding the MSM communities and also the Asian gay men community. Substance use, poppers, erectile dysfunctional drugs were the most reported substance that participants had used. It also appeared that poppers users also use marijuana, ecstasy, and erectile dysfunction drugs. They also use it, but it has to be also noted that we did not ask the participants whether they use the substances at the same time, so they may not use these substances concurrently. And we only did 2 like drug combinations here to see the pattern, to see the overall pattern. But we can still have a sense of what kind of substances were used commonly among the Asian gay men survey participants. We also find that knowledge on undetectable viral load was quite low among the participants, with less than 1/3 of participants correctly answer that it was extremely unlikely for HIV transmission to take place when having sex with a person with an undetectable viral load. We need to apologize that probably a more appropriate term is impossible rather than extremely unlikely. But we can still see that the knowledge of use equal U was not very common among the participants in the survey. This was further supported by nearly 60% of participants reported they would avoid having sex with HIV positive people regardless of their viral load status. Last but not least, regarding mental health, we used the standardized K6 distress scale to assess the participants' mental health status. We used this scale because it was short and has been translated into different languages, and the translation has been validated. So, and the translated versions was publicly available, so we did not have to translate them by ourselves. And we found that around 1 in 4 participants were at risk for serious mental health illnesses, which was highly comparable with to a study conducted among gay and bisexual men in Australia in 2016. They were not focusing on Asian men, but probably in a more general gay and bisexual men population. And they used K6 scale and found 22% of their participants were at risk for mental health distress, which was very comparable with our findings. Predictors of poorer mental well-being, including like having had experienced racism from members in the general Australian society, having experienced domestic violence, earning less than $500 a week, and without any LGBTIQ friends in Australia. So I've talked about lots of findings. Here's some recap before Limin joined me to discuss some lessons learned in the condition of the survey. So first of all, HIV and STI testing rates have decreased in the latest round of the gay Asian men survey. Many participants have switched to PrEP from condom use, and PrEP use was affected by language factors, income, and visa status. In this survey, we found that. And sharing of PrEP was common. And we have to be aware of the transnational sexual ties, where that our participant did not only have sex in Australia, they may have sex with someone overseas. That's something that we also need to be aware of in future studies. And there is also a suboptimal knowledge on U equals U. And the mental health is another area that we have to be aware of. We have to be aware of in the Asian gay men community. Last but not least, we have to be reminded that there was the impact of COVID on sampling and result that can affect the results comparability with the previous rounds of the survey. So now I would like to invite Limin to join us and talk about some lessons learned and reflection in relation to conducting the survey. But there was some Q&A, isn't it?
Yeah, thanks, Horace. So probably let's start with kind of survey questions when we designed, because Horace was actually leading the part of consulting with the community and thinking of, we actually put some of the Horace PhD in the transnational kind of transnationalism into the questionnaire design. For example, Horace, can you, for example, we looked at sex in overseas, not only in Australia. We looked at people who recently arrived in Australia and their HIV testing history. Also, we looked at their cultural ties, migration, even their religious beliefs. And yeah, so what is your reflection, Horace, about this, kind of having a bit more transnational component?
Yes. I remember when we were doing the first first gay engagement survey back in 2016, 2015. At the time, I just came here as a PhD student, as your PhD students, and then when I look at the survey, I was thinking it was really similar back in 2015. The questionnaire was very similar to the periodic survey. And as a recent migrant at the time, coming to Australia and looking at the survey, I was like, well, this survey asking a lot of questions that was not related to my life living here as a recent migrant at the time. And over the years, I felt that, and also because of my PhD study, I really have found that many migrants, if you're looking at migrants, how people migrating in Australia, their life is not just only in Australia. They have lots of ties, maintaining a lot of transnational ties, sexual ties, information ties, or financial ties with people outside Australia. So when I was structuring, designing this questionnaire based on our previous exam experience, I feel that when we're looking at an Asian gay men survey or any kind of survey, including the whole community, we have to think from a more kind of what we call methodological translationism. We have to think outside. We have to think broader, not reminding us that people not only having sex here, people also have a life outside Australia. So we can adopt more like a migrant health approach to look at HIV and STI risks, rather than, because like 20 or 30 years ago, when the migration was not that common in Australia, we probably in the 80s or 90s, we did a lot of study within the Australian context. But I think nowadays, we looking at the Asian Gay Men Survey, we have to broaden our horizon. We have to think a little bit broader to include how people get have sex overseas and how people get their information overseas. Like when I was doing my PhD study before the COVID time, quite a few of my participants, actually they did not test in Australia, but they tested overseas because they found that at that time the service was not accessible for them. So every time they may go back to their home country every 1 or 2 times a year. And when they went back, they took the chance to have HIV test. And they also have a lot of friends outside Australia. So that's the translational bit of this survey when I was thinking. So I asked a lot of migration related factors. I asked a lot of questions about overseas sex, etc. Yeah.
Thanks. So Horace, after the transnational kind of component, let's look at the translation component. So what we learned, you've also published paper why you get involved with Ali Carter, the Asher study that trying to translate the big Asher, some of the questions into different language, including Chinese, but also us kind of trying to use some even quite standard, BBV STI questions in our survey. Some we have asked for many years. But what we find is, through some kind of the papers that we publish, not particularly in this Gay Asian Men survey, but working COD community, is actually even the questions that we think are quite standard, quite people, when you involve a group of quite knowledgeable experts to translate into their languages, there's often confusion. There's not much, the consensus are quite low in terms of what is a appropriate culturally safe language to translate. Do you want to talk a little bit about we know that back translation is no longer the standard because, for the very, specific nature of our questions in terms of culture, sex and culture taboo, but also, kind of some vague language, for example, effective HIV treatment. It can be quite confusing to some communities. Do you want to talk a little bit about that, please?
Yeah, for the translation part, I worked with Alison Carter last year. 2 years ago, we published a paper about translating sexual and reproductive health survey, and we found that there were 3 factors, maybe 3 themes that can affect translation. First of all, is that the cultural meanings of some terms may not be the same, may not be that translatable from English to other languages. So some example, we used because we with the project with Ali, we were talking about translating the English survey into Chinese, and back then we found that some terms like expectation, even though that term can be translated directly from English to Chinese, but the meaning of the expectation and the context of the verbal context has changed a little bit. And even the term HIV, we translate it to Chinese directly, but it becomes AIDS virus. That's a little bit stigmatizing. So that's one factor. The other factor is that the translator has to be involved in the survey development, in the survey translation. So they were informed about the skip logic. They were informed about what questions we're asking. They were informed about the context of the question. This is not always feasible. We understand that. In this time, in the engagement survey, actually, I did the translation for the Chinese because I can speak both languages, Chinese and English. So I decided Chinese and English survey concurrently. But at the same time, traditional Chinese and the simplified Chinese, because I use traditional Chinese, although they are kind of understandable mutually, but there are some nuance in the terms and grammar, they're different. So I have to find another translator to translate the traditional Chinese based on the to simplify Chinese based on the traditional Chinese version that I did. And I don't speak Thai, so we find a Thai translator to translate it, and it was very expensive. So translation is very expensive. So one way probably is to, if possible, when I was doing that, I was thinking if that would be great if we could involve people who can speak different languages in the research team. That may not be easy task, but I was thinking maybe if we're talking about translationalism, why don't we include overseas researchers or overseas scholars? Well, I was thinking maybe next time we can invite people from Thailand, etc., the researcher from Thailand. Then we work together, because if we are looking at like questions, questions and issues that are happening here and also in Thailand, probably we can do that together, and then they can make sure that those Thai translation is appropriate to Thai people, rather than we just find other translator to translate it. But if that's not feasible, we could also ask community member to help checking the translation. I remember we asked a few different community members, Thai-speaking community members, to check our translation. I think this is a very important, or at least what we should do is after the translation, we cannot just find a company to translate the survey. We have to check it with the community member, with the target audience. This is one way that we have to do that. Yeah.
Yeah, and I'll also probably think for the research community too, that once we translated those versions, probably we share with each other as a good way of group practice and, improve on each other's kind of practice. Yeah. So maybe another, we will open up for Q&A soonish. So probably let's talk about two issues. One is, we talk about a bit diversity under the big umbrella named Gay Asian Men. Probably, Horace, can you talk a bit about what we find in the survey is actually for our Gay Asian men, the PrEP access is actually, quite a two-world situation. One group of the participants, they are quite connected to the local community or local friends, and they are Medicare eligible, so they can get the prescription, and income-wise they are quite affluent to afford the kind of PrEP from the pharmacies, for example. But there is this group, they are likely to be Medicare ineligible, their income is quite low, and they often, even they get a prescription from here, some people might not even get a prescription, then they have to order from overseas online, ordering and all that. And due to the COVID, some of those kind of website, the quality and first, logistics are not guaranteed. You never know when it will come, and also the quality might not be, kind of guaranteed. So, do you want to say a little bit about, so what we here find is a quite interesting kind of quite a significant proportion of, PrEP diversion in a way.
Yeah. When I just have to. Because this time I did when we do in the binary regression, logistic regression, I did adjust for Medicare status, and this year Medicare status wasn't really a factor affecting PrEP use. Probably because of most of the participants this time were having compared to before, they had Medicare, and the second of all, there are more people using PrEP nowadays. But yes, true, we still see a difference of PrEP use among so-called Asian gay men community. I think we all know that Asian gay men is just like is a really heterogeneous. It's so different. Everyone's so different in the so-called Asian gay men community, and then all these migration things. It's happening. Migration related factors like visas, like the employment and incomes, and also speaking in English. They definitely affect people's use of PrEP. I'm not speaking as a nurse or clinician perspective. At the clinic, we see a lot of people come, they just don't know how to get PrEP, or they just don't know how to get their medication or PrEP, not because they don't know about it. They know about PrEP because they ask about it, because I could speak Chinese, or like my Chinese international students, like because I can speak Chinese, they asked me. But other than that, they did not know how to get more information. But the information out there. So I was thinking probably the information of when I'm talking about Chinese speaking people, particularly, probably those information were not accessible to them or were not in their face compared to back then when I was working in the clinic. But nowadays we can see a lot of different new like Chinese campaign. And then at the same time, we think about other groups of people, maybe not Asian gay men, maybe the South American men, or other maybe Thai speaking people. There are different languages resources out there, but it seems that they are not in their face. That's what I've thought. And at the same time, that there were a lot of people talking back about the Asian gay man community. Of course, there was like different generations of migrants, like Australian-born second generation, or like me, just came here a few 7 or 8 years ago, or people who just came here. And different people have different kind of like assimilation cultural assimilation, or the cultural or the translational tie. People who were born in Australia, of course, they might not have that strong transnational tie with countries outside Australia. But people who just came here, probably they have a lot of friends and support outside Australia, but not in Australia. That doesn't mean that they don't have any support. It's just how we can utilize those translational supports to help these people. I've been thinking about actually looking at the UNA's policy documents. They've been talking about increasing international support, international collaboration between each country. So that may be something that we can think about. Yeah, hopefully I've answered your question. There's so many things happening in my head right now. Yeah.
And probably go back to you, or we address some questions. There's about 10 minutes.
Yeah, that sounds great. So Rada, can you drop the slides and we'll just have
Sure.
Horace? Yep.
Stop sharing. Yeah.
Great. So thanks so much for that. That was really interesting. We do have quite a few questions and comments coming through. And Limin, I know you've answered a couple by typing. I might just start with some of the more question ones rather than the comments while we have you, since there's only 10 minutes left. So Alison has asked, was there an overlap with non-consensual sex and drug usage? Have you looked at that?
I haven't run that the analysis, but I can do that. Maybe send me an email and I'll answer the questions later. Yeah, we didn't run the one that here about non-consensual sex and drug use. That's a good point.
Yep,
yes.
That's certainly something you probably can do. We've got a great question here from Curtis, which is sort of asking the two of you to cast your minds forward, what you're going to do next time. So if you do another round of the GAM survey, what would you change? And what questions would you like to include in a future version?
Limin, what do you think?
I was trying to kind of direct that question, because I know there's currently a few questions, few questionnaires or studies. Ben is leading the big Asian Pacific PrEP study, and in Melbourne, Jason Long's group is also, kind of doing a few with, crowdsourcing and kind of focusing on overseas born Asian kind of that. Maybe Horace, think about the way that we see how eventually that, you know, that this kind of surveillance, it can empower people. Do you want to say something about your thinking?
I'm not sure about empowerment, but I always think that this kind of survey is a very good, always any kind of survey like this with a lot of resources being put in, is always a good opportunity to engage with the community. It's always a good opportunity to build a kind of like a community. So if we do a more inclusive survey, that if we're looking at like people, migrants or other people from different backgrounds, we do it more inclusively, then the people will understand that actually we care about them. And then we can, through this, we can build up a kind of community and reach the people. And actually we can, and like for this survey, and some people saw this survey advertisement online, and then they found, okay, actually there's someone doing research about me, or actually there was like association doing research about this. And from then they can find more information about that. So I always believe that this kind of survey is not only taking information from the community, but actually working with the community and actually help the community. Yeah.
And I think, Horace, that's been a hallmark of this project for the last, certainly all the rounds that I've known about, that it's really almost a community development exercise,
Yes,
as well as an exercise to gather data. And I think Harrison from ACON's made this great point here that he's sort of calling us to pay attention to the fact that it's not just about having data that you get, but also that the impact of having a tailored community-specific survey that specifically tries to map out the experience of this group uncovers stories and experiences that we might not find elsewhere. And I think that's a really nice point about that.
yes. And I think we need to work with the community and also always give feedback and disseminate all the results so that they know that they gave the data to us, we really did something, and they have a better understanding of the entire community from a broader perspective.
Yeah, so just a shout out. I mean, ACON hasn't informed me which date, but we're planning with ACON to do a bit more community-based, event-based dissemination.
Fantastic. We've got a question from Ye from the Kirby Institute. So saying, thanks for a great presentation. Wondering if you knew what percentage of the participants are students. I think you should know that, if you can find it.
Probably check our report, or if not, send us an email. The 2018 one, we had about 20 or 25% international students. So we had a report. But this year, international is that 10 or 15%?
I think I have, just a second, I have the PowerPoint open up, and the student visa, I got 16% of the participants this year reported they were actually not holding a student visa or temporary graduate visa. So 16% of people born overseas. So that would be about 10%, actually, about 10% of temporary visa holder, student visa holder in this round of survey. So compared to previous rounds, so a lot of international students is not here in Australia, unfortunately. But hopefully more people will come back, and then we provide more a platform to help them and let them know that we're actually doing trying to improve their health.
Yeah, absolutely. This study, as you'll all know, on the seminar today, that any of the studies that are sort of have been repeated cross-sectional or longitudinal in some way have all been impacted massively by COVID, and it's going to be something that we have to explain in our data sets for the next 50 years. We're all going to have to talk about what happened. Yes. We've got a question from Epic Indonesia saying, do you have any insights on how to recruit participants who are not already engaged with cold networks and may not be necessarily comfortable with identifying as gay or bisexual? What about cold populations with lower levels of digital literacy?
This is a very, very relevant question. It's a very good question. We have always been thinking about how to enroll people who are not attached to the so-called gay community in Australia. And actually, Curtis and also do planning, writing, and doing some analysis around community engagement based on the survey data here. But I think, first of all, we have to be aware that all studies have their limitation. And no matter how well we do, some people will not be reached. So that's why we need different kind of surveys using different kind of strategies. And I think sorry, what was the question? I'm just looking at the question here. Yeah, basically comfortable with identifying as gays and bisexual. Yeah, so if we are doing a like Asian gay men survey or Asian men survey, that will recruit people who are more comfortable identifying as gay and bisexual. I remember just sharing an example, kind of remind me a kind of story. When I first came here working with ACON back in 7 or 8 years ago, I remember there was a study, there was an event at Event Cinema putting a huge billboard on huge sign saying Asian gay men here for help. And then I'm like, when I first came here, I would definitely not go there. I don't want people knowing that I'm Asian gay man going to seek your help. So but at the same time, we recruit a lot of people who are more attached to the community. So we always have like, it's like a double-edged sword. We have advantages and drawbacks, but we always need to be aware that when we're doing this, we miss certain type of people. And next time or other studies, we have to target those people. But yes, yeah. And how about population with lower level of digital literacy? Previously, we were doing this survey in venues as well. So we actually recruited people, older people. Actually, we recruited 70 or 80 years old people. They were really detached from the so-called communities, and they only seek sex partner in kind of like saunas and stuff. They didn't know anything about that. We do recruit that, but this time we were not able to do so because we just only use Facebook. But also speaking back to Curtis' questions before, next time, definitely want to try to do more venue recruitment as well, and as well as online recruitment to try to capture different members in the community.
Yeah, just also add to Allison's question. Actually, this time, or the Epic of Indonesia too, this time using pure online advertisement, and thanks to ACON was leading mainly through Facebook, we actually recruited more people from rural and remote New South Wales than ever before. So, it used to be our venue-based. We had online and venue-based. Venue-based is really targeting the gay, community gay events and all that in the inner city. This time we try to expand out, but we find that online, if we do properly, and you can have better outreach than just venue-based.
All right, thanks. There are just a couple of other questions and comments there, so I'll let Horas and Limin just make sure you read those before this session ends. And if anyone wants to follow up directly with Horas and Limin, please feel free about ideas for the future or any ideas for the current round. I know they really welcome any engagement. So it's 1:59 now, so we'll end the session now. And just huge thanks to Horas and Limin for coming along today and presenting. We always appreciate your partnership and working with you, and it was a real pleasure to hear about the study. Thanks everyone for coming, and we'll see you next week at the seminar series.
Yeah.